Functional medicine goes beyond the standard medicine approach where we're actually looking at the root causes and we're seeing the person as a whole human being. Antibiotics really destroy the gut microbiome, particularly if they're what we call broad spectrum, and it can sometimes take up to 2 years for the gut microbiome to grow back.
I'm surprised that C-section is linked also to allergies in babies. Mm-hmm. Does this mean that having a natural birth, the microbiome of the mom is transferred somehow to the baby?
There's a higher risk of things like autism spectrum disorder being linked to C-section, increased risk of leukemia in some studies. So if we can, we would like to avoid a C-section if it's possible.
هاي أهلا بكم في حلقة جديدة من بودكاست فيتالاب. معكم نوع منصور your host for today. حلقتنا النهاردة هتكون حلقة مميزة لكل امرأة بتحضر للأمومة أو بتحضر لمرحلة الحمل. سواء إذا كنت أنت في مرحلة التحضير أو already a new mommy أو في مرحلة التعافي، فهي التعافي بعد الحمل، فالحلقة دي أكيد ليكي. النهاردة ضيفتنا ضيفة مميزة في مجالها، دكتور وفاء. هي دكتورة معتمدة في طب الأسرة والطب الوظيفي أو functional medicine doctor. هي متخصصة في صحة الأم والطفل من منظور شمولي وكمان في الاضطرابات النمائية. أهلا بيكي دكتور وفاء. Hello Dr. Wafa and welcome for our podcast.
Hi, thank you for having me on. Thank you.
تنويه بسيط، الحلقة دي راح تكون باللغة الإنجليزية ومترجمة بالعربي على قناتنا على اليوتيوب وراح تكون مقسمة إلى قسمين فما تفوتوهاش. Hello Dr. Wafa, thank you for coming today. I'm super happy that we're having this discussion because it's a crazy topic for every mommy and everyone who's actually preparing for pregnancy. I want to start from the beginning. What's a functional medicine? Because everyone is asking me this. What's a functional medicine?
So functional medicine goes beyond the standard medicine approach where we're actually looking at the root causes and we're seeing the person as a whole human being, not as separate body parts to be investigated by different doctors, but rather we're seeing the overall picture. We're getting to know the person and their issues. We really like to get to know the patient for who they are as a human. And then we look at the root causes of their issues to address it at that level so that they can have overall healing.
So there is like certain approach for functional medicine, like looking into the root cause, like certain supplementations and certain personalization for each person because each person is different. Is that correct?
So we have advanced testing that the standard approach doesn't look at. And so what we would look at is, for instance, how hormones are used in the body, how nutrients are absorbed rather than just total levels. We'd be looking at things like gut health in very, a lot of detail. We'd be looking at dysbiosis, which is where the person can have abnormal gut bacteria. We'd be looking at things like heavy metals, environmental toxins like mold and other pollutants in the environment and how they affect the body.
Okay, so our episode is going to talk about pregnancy and how we actually prepare for pregnancy. Yeah. So as a start, we want to start from the beginning. If there is a couple, they are preparing for pregnancy, where they should start and how does it work for them? How would it look like for them?
So both the husband and wife need to come in for a comprehensive assessment because we need to optimize the quality of both the egg and the sperm, and ideally 3 to 6 months beforehand. Mm-hmm. For that preparation to really change their diet, change their lifestyle habits, optimize their supplementation based on their personalized tests. And so what we'd be looking at is getting the basics right. And then if they have any issues, to be looking to do further testing.
Okay, so if there is a pump on the road and there is a problem with fertility, so what would this be shaped and how would it look like? At that point, with hormonal changes for the women and for the man, if there is like a problem with the hormones. So how would they understand that there is actually a problem that they need to address? Of course, if they didn't go to a functional medicine doctor at that point.
Right, so the biggest warning sign for a woman is not having a regular period. That's a sign that she needs to get that investigated. And for the man, he can do a semen sample and that will look at the sperm quality. Is not usually assessed, but it will look at how the sperm moves and the numbers of that and how healthy they are is optimized through functional medicine. So we offer genetic testing for both partners in order to optimize and give a personalized nutrition plan and supplementation and diet plan based on your unique genetic makeup.
So is it true that actually the sperm quality can actually impact how women feel even during pregnancy?
Well, the sperm quality can affect the placental development, and whether you have recurrent miscarriages or not can be coming from the sperm. So we do need to address both in order to prevent things like recurrent miscarriages and to optimize the health of the placenta and obviously the baby going forward. So the father's traits are imprinted not just genetically, but what we call epigenetically. So that means the father's habits in terms of smoking, diet, exercise, all get imprinted on that embryo. And so that's really important for the father to do as well as the mother.
So the baby's health or microbiome, is it shaped by both the parents, right? Am I just trying to get right? So is it shaped by both parents?
So the microbiome itself is transmitted from mother to baby during pregnancy and also after birth. And who the mother comes into contact with and close contact with shapes the mother's microbiome. So we would need both parents to be really healthy and optimizing their gut health and checking their gut health before we attempt a pregnancy.
So does this mean that actually fertility also starts with gut health, like dysbiosis, if there is a dysbiosis or imbalances in the microbiome, does it actually impact the fertility?
So it can impact the fertility, but fertility is a whole body issue. So it's brain, ovaries, gut, overall health, metabolic health primarily that affects fertility. So gut health is one of the essential elements of fertility, and it's often overlooked through standard conventional medicine approaches, which don't always check gut health.
And so if I go back to the mommy or the woman here, because us women doesn't understand the irregularities in hormones. So we're always told that, okay, there is a certain markers, there is certain numbers that we have to look at. But I know when it goes to functional medicine, there is a different way in looking into the hormones for women. So how do you look into the hormones?
Well, it's not just for women, it's for women and men. But what we do is, in conventional medicine, you will have a total hormone level like LH, FSH. And what I want to tell women is that you are not your number. And the lab range can be very variable. So what's normal for you may not be what's defined as normal by the lab. So the lab has 2 standard deviations each side of the mean. But what's best to do is to compare that level for what your previous level was. Okay, so what's normal for you? And in functional medicine, we also look at how those hormones are metabolized in the body, how they are transformed in the body, how they're eliminated. So how your body uses the hormone in the right proportion, because that will also affect fertility rather than just the total level.
So if I look into it like now, there is like AMH type of testing, and there is several testing that's done by the conventional medicine. But does this mean anything in the functional medicine? Like, or there is certain type of testing that this is the first marker that you look into of any woman that a woman can come to you?
So these total hormone levels, they are helpful, but AMH just tells us about the number of eggs. And so the thing is, you only need 1 egg, and AMH doesn't tell us about the quality of the eggs, which is what we are looking at in functional medicine. We're looking to optimize the quality of the egg, so that even if you have a low AMH, we can optimize those eggs to be as fertile as possible.
And if women are taking contraceptives, how do we look into it from your point of view? Like, how can she stop contraceptives and get her period back and hormones back in place? Is there a way or steps that she should follow?
So depending on the type of contraception, it will either naturally come out of the system once you stop it. So depending on the type of contraception will depend on how long it takes for your fertility to return, and also the duration of time that you've been on the contraceptive. So the longer duration of time you've been on the contraceptive may take longer for your fertility to return. Equally, if you've been on things like the injection, typically the injection is associated with a longer delay to fertility returning. So it can be 12 months, sometimes very rarely up to 18 months, that you're waiting before your periods return. Often I see patients who stop the contraceptive and expect their period back the next month, and that doesn't always happen. And so waiting until we get our period back is important, but also remembering that not having a period or being on contraception can mask an underlying issue. So for instance, if you have PCOS and you don't have regular periods anyway, if you've been on contraception, you might not know about that, right? So it can mask underlying issues as well.
So when we come for testing, it's just like, is there like a baseline for testing, like certain types of testing that we should look into, especially if someone doesn't know how to go to a functional medicine doctor, or they don't have someone in their area? Is there a certain things that the women should do or ask for certain tests with her doctor?
So for insulin resistance, things like that might be associated with PCOS and diabetes, pre-diabetes, we need to check the fasting insulin and the fasting glucose. And if you're not pregnant, you can also check the HbA1c as well. So this gives you more of a detail as to whether you have the start of insulin resistance or pre-diabetes before you become diabetic.
And would this impact also the gestational diabetes and preeclampsia during pregnancy? Can they prevent it from happening? So
we know that the people who are at highest risk of gestational diabetes are those who are pre-diabetic before pregnancy. So it's important to identify before you become pregnant or try for a baby whether you could have pre-diabetes, because then you can take the right steps to try and reverse that with diet, exercise, nutrition and supplementation to reduce your sugar levels and your insulin resistance.
Okay, so now if the numbers are okay and everything, but there's still a problem with fertility. Most clinics actually say that you should go for IVF. My understanding for IVF, sometimes it actually doesn't work. So I know lots of people who did it like 9 times, 8 times, and still not working.
Yep.
Okay, so what's wrong here from your point of view, and how can they address this?
So IVF helps the sperm to meet the egg, so it will address any structural issues that are there, like if there's damage to the tubes, for instance. But what it doesn't address is the quality of the egg and the sperm, which is what we do in functional medicine. So I've had patients who have, like you say, recurrent IVF treatments, but they keep having recurrent pregnancy loss, or they don't get pregnant. And so that's where we come in to check genetically what are the risks, how can we optimize the pregnancy based on your unique genetic makeup with targeted supplementation, targeted diet to reduce the risk of recurrent miscarriage, gestational diabetes, preeclampsia, new tube defects. We have tests that specifically look at these risks in pregnancy from a genetic perspective, but also there can be underlying things like autoimmune disease and autoimmune antibodies. I had a lady who had been for 7 rounds of IVF and nobody had addressed the autoimmune antibody level in her blood.
Wow.
Yeah.
So autoimmune also, if it's not addressed from the beginning, so IVF won't work at the end of the day.
Well, it can lead to a lot of stress and frustration when the IVF fails, and IVF itself is stressful. So we want to avoid having too many rounds of this by actually optimizing the egg and sperm quality before we go and have the IVF.
So it's all going back that we have to address the root cause. If we don't address the root cause, then other abnormalities will come up, and of course, at this point, we will have frustration, stress, and then we won't be able to.
Well, regardless of whether you have IVF or
yes,
optimizing the pregnancy is important for the baby's future health as well. It's not just about the IVF. It's we want the healthiest baby that we can have, and therefore we need to go back and address the root causes, even if we're not having IVF. So even if couples do not have IVF, we need to optimize the baby for their future health.
Okay, so you mentioned lots of genetic testing. Yeah. Is this the same like a DNA testing that we have nowadays, or we hear about nowadays?
So what they do in hospitals is usually different. What we do in functional medicine is something called SNPs, or single nucleotide polymorphisms, which are many genes. So we check for many genes, including the sort of more trendy ones nowadays, like the methylation genes. So we check for 9 genes related to methylation. that can affect the pregnancy, for instance, as well as a whole lot of other genes where we can actually intervene. So it's not just we're checking genes for the sake of it, we're checking genes that we can modify through diet, through exercise, through supplementation. So genes that we have the ability to impact is what we're looking at.
Okay, but does this mean, is methylation genes, is it the same like when we say like taking folic acid or methylfolate? What's the difference between them? Because I hear a lot there is a big difference and it might not work for certain people also as well.
Right, so folic acid is a synthetic vitamin, and folate is the biologically active vitamin that we actually absorb. If you have a genetic problem with the methylation genes, you have a problem with converting the folic acid into folate that is needed for the pregnancy. So if that happens, we can still end up with problems in the baby, even if we're taking the folic acid in supplements. So we have to be careful to get this checked, because then we can switch to the right form of bioavailable folate that our baby needs.
Does every woman need to take vitamin B or methylfolate, for example? So if you're preparing for pregnancy, does she have to take vitamin B anyway?
Yeah, absolutely. It's one of those essential vitamins that we recommend all pregnant women take, in addition to things like omega-3, in addition to things like vitamin D with K2 to help get the calcium into the bones, and omega-3 for the brain development of the baby. So all of those things combined are really important for every pregnant woman to take. And then anything beyond that is personalized based on their unique lab results.
So if we said like 3 top supplements that you recommend and at this stage preparing for pregnancy, what are they?
So there were 3 I just mentioned: omega-3, vitamin D, methylfolate, but also you need to be topped up on your iron before you get pregnant. Iron is really important for baby's development. So ideally, before you even get pregnant, your iron is good to go.
I have a question about iron, actually. The ferritin, because also like we have lots of supplements in the market. Some of them are ferritin oxide, some of them have ferritin glycinate. So what type of iron form do you recommend? Or is it different from one person to another?
So it's what you tolerate. So often the iron is given in very high doses where women cannot tolerate them because they have the side effect of constipation, abdominal pain and bloating, which is not something that we want when we're pregnant. So we would tailor the dose to what the woman can tolerate. And that may be a regular lower dose rather than a very high dose for a shorter period of time.
Just to wrap up this part where and we're talking about the preparation for pregnancy. So basically the couple have to, both of them have to work on this 3 to 6 months before actually start on the plan for getting pregnant. And they have to look into their nutrition, their numbers, go to a doctor that will help them to work a proper plan for their nutrition, and preferably a functional medicine doctor to do that. Is there anything that women should avoid doing during this period?
Avoid doing is usually eating things like raw food, which can contain bacteria. But you shouldn't necessarily avoid exercise if you've been exercising before pregnancy. Pregnancy is not a reason to stop exercising. In fact, we do recommend that you continue walking or doing whatever sports you are able within the limitations of your pain.
Okay, so now everything is perfect. Alhamdulillah, they got pregnant. And women suffer a lot in the first trimester from nausea, fatigue, tiredness, low energy levels. What do you recommend at this period women should do?
Okay, so this is a tiring part where you can have sickness and women might not always feel like they want to eat. So it's important to stay very well hydrated with fluids and electrolytes. You might also have sweet cravings. And so it's important that we don't overdose on junk foods, sweet foods that can raise our blood sugar and then impact the baby. So we want to stick to natural things like berries and fruits and dates rather than chocolate bars and energy drinks and these kind of things.
There is like a lot of testing related to diabetes during pregnancy. Is it done for everyone, or does everyone has to do it, or certain women have to do it? If they have insulin resistance, for example, they have to check their markers every now and then while pregnant.
So testing for diabetes in pregnancy is done for high-risk women. So they do a risk assessment of how likely you are to have diabetes, and then your obstetrician will usually organise that to be done.
So we said that the immunity starts from the womb for the baby, but the preparation for this helps the baby to have a proper immunity. And does there anything the women should do while they're pregnant to also improve their immunity for the baby?
So we talked about the gut microbiome as being really important because the gut microbiome is transmitted to the baby, and so the beneficial things from mum's gut can go to the baby and therefore help in the baby's immune development. So things like mother having probiotics and reducing gut inflammation before she becomes pregnant. But also when you are pregnant, certain strains of probiotics have been found to be helpful.
And is there there's lots of supplementation in the market that says to be taken during pregnancy. Do women need that? Or as we said before, she needs like a personalized plan anyway?
So a personalized plan is really important because some people genetically will be prone to different vitamin deficiencies than other people. And so that's why I can't give a blanket supplement for every single person. It has to be tailored to what your body uniquely needs.
And what about antibiotics? So if the mom before pregnancy took antibiotic, or she got sick, anyhow, like during pregnancy, it's not allowed for them to take antibiotics anyway. So what's your take about antibiotics in general, like how to address this?
So antibiotics really destroy the gut microbiome, particularly if they're what we call broad spectrum, and it can sometimes take up to 2 years for the gut microbiome to grow back.
2 years?
Yeah.
Wow.
So ideally we want to avoid antibiotics where possible, especially if there's a soft indication for giving them. Then we want to express the preference that we don't really wish for antibiotics because they will disrupt the gut, and disrupting the mum's gut will disrupt the baby's immune development. And equally, the baby having antibiotics after they're born within that first 2 years of life also disturbs their immunity and puts them at increased risk of chronic disease. So antibiotics are something that we would prefer, if possible, that we could avoid.
And if she took the antibiotics, she needs to take a probiotic or prebiotic afterwards, or how can she reset her gut if she didn't have like the proper doctor in place, like the functional medicine doctor that will help her to regain her microbiome again, proper microbiome. So what women should do at that point?
Yeah, so we always recommend probiotics with antibiotics to be there. So probiotics will help to rebuild the microbiome that bit quicker, and so they're always useful to take.
And during a pregnancy, there is lots of talk about like if she has food sensitivities and allergies, it might go to the baby. Is that true or not?
So antibodies in the mother's bloodstream can cross the placenta and affect the baby. So these are autoimmune antibodies or allergic type features. So what we need to do is get the mother to address food sensitivities and address her gut health and her autoimmune antibody levels before she becomes pregnant. So we reduce the risk of the transmission and then chronic disease development in the baby.
So everything is before the pregnancy. It's like during the pregnancy, khalas, it's done, and alhamdulillah, everything is balanced. So she just continue with the pregnancy.
Lots of women come to me for detox during pregnancy, but unfortunately at that point it's a bit late because the baby has started dividing and growing very rapidly. So we need to do that before. Also, lots of supplements and medications aren't tested during pregnancy, so we don't want to take that risk of giving a medication that we don't know what kind of side effects may have. So everything needs to be done really ideally before the pregnancy.
So when she reached to delivery, inshallah, and there is always the talk about C-section or natural birth. Some women actually prefer C-section over natural birth because of the pain and everything. What's your intake on this? And what do you think about the benefits of actually having a natural birth over a C-section or vice versa?
So having a natural delivery has many benefits over C-section. I can understand why women are scared. We've been programmed to be scared through media, through film. that birth is a scary thing. So what we really need to do is educate ourselves about positive birth experience. Women who have had a natural birth and had a fantastic experience, women who have not used pain relief, women who have used different options. And so we can explore the wide variety of options out there, rather than just assuming that it's going to be painful, rather than just assuming it's going to be scary. So we do need to research, and I would advise all women to go on some courses beforehand, like hypnobirthing or birth preparation courses, where they can explain to you these different options.
So I just want to know, like, from your point of view, what type of options that women have other for her to choose, or be well educated at this point, because we hear lots of things nowadays and there is lots of approaches, having a doula, not having a doula, having a midwife or not having a midwife. Mm-hmm. So from your experience, what do you recommend? Especially in the region here, not everything is available. So what do you think?
Okay, so if you are looking to have a natural birth, the specialists in natural birth are called midwives. Mm. And so going ideally to a midwife-led unit would be, if you're a low-risk pregnancy, a good option. The difference between a midwife-led unit, which is very common abroad in Europe and places like the US, is you have a private room, it's dark, you don't have bright lights in your eyes, it's less stressful, you don't have people walking in and out the room, you have equipment to keep you mobile during labor in there, you don't have the beeping sound of machines going off, you're not strapped and wired up to machines, so it's less stressful. And you need to reduce the stress in order to have that natural progression in delivery. If you're stressed, it can actually lead to what they commonly call failure to progress, which is just taking too long in labour. That can often lead to induction, and that can often lead to C-section. And the problem with C-section is it increases all sorts of risk for the baby. So all sorts of childhood illnesses are at increased risk. So for instance, with C-section, you're at increased risk of obesity, type 1 diabetes, asthma, allergies. There's a higher risk of things like autism spectrum disorder being linked to C-section, increased risk of leukemia in some studies. So if we can, we would like to avoid a C-section if it's possible, but it's not always avoidable. There will be some conditions where C-section is absolutely the right thing to do, and it will be life-saving, and we need to do that. Mm-hmm. But people don't seem to understand that the obstetrician is a surgeon, and a surgeon likes to operate. And so if you're not looking for that, you need to look for alternative professionals to help you deliver naturally.
So just because I'm surprised actually that C-section is linked also to allergies in babies. Mm-hmm. Does that mean that having a natural birth, the microbiome of the mom is transferred somehow to the baby or impacting the baby?
Yeah, absolutely. So when the baby goes through the birth canal, the colonic bacteria from the mother, they kind of prime the infant's gut, and that primes their immune system. So microbiome in the baby equaled immune development. It sets up their immune development. So we cannot replicate that. So if a baby is born by C-section, they will be colonized with skin bacteria and bacteria from hospital staff. They won't have the mother's microbiome that she has in her colon. At this period of time, despite all of our latest technology, we cannot replicate that gut bacteria except in research settings. Mm-hmm. So something called fecal matter transplant has been shown to essentially, if you have a C-section baby, the microbiome of that baby will be exactly like as if they had a natural delivery. But that's for experimental use only. It's not available commercially. Mm-hmm. So commercially, we cannot replicate that, and the damage done to the microbiome from C-section is kind of irreversible.
And so there is this thing about delayed cord clamping for the baby. Does this also affect the baby? Because I know that in most hospitals it's just snipped and that's it right away.
So delayed cord clamping is where we wait for the blood to go back to the baby from the cord, and so that delivers stem cells to the baby, which helps the baby repair, and also it means it protects the baby long term against things like anemia, developing anemia in the future. So if you do give birth naturally, then you can just wait for the cord to stop pulsating before it's cut.
So is there like so mummies can ask for this, like if they're
you can put it in your birth plan. Yeah, absolutely.
And is there like a certain way of knowing, or the doctor would know anyway that when she asks for it?
The thing is, when you're in labor, you're in a compromised position. You can't advocate for yourself. So ideally, you've put everything in writing. You've hired a doula who will make sure that the team stick to your birth plan beforehand.
And is there other stuff that mummies need to take care of in the surgery room, other than the delayed cord clamping and other stuff related to her choice of if she wants to take epidural or not, and other stuff that related to her birthing at that time? Is there other stuff she needs to look into also as well, or highlight at that point?
So your preference is you can have a look at the different pain relief options and you can express those pain relief options. But things that are really important immediately after the baby is born is skin to skin. People underestimate this, and most hospitals, they just give 1 hour of skin to skin. But what the recent research has shown that you need 21 hours of no separation.
Wow.
It improves outcomes for the baby, reduced risk of death, reduced risk of pneumonia, reduced risk of stress. For the baby, it sets their vagal tone if the baby is very stressed. And for the baby, separation from the mother is stress. So we need to keep the mother and baby together for as long as possible, skin to skin. And if the mother needs to take a break, she can give the baby to the father, skin to skin. But we don't like the baby being passed around really because they don't have an awful lot of immunity at that time. But skin to skin for 21 hours after birth. And even if the baby needs a tube or the baby needs to have bloods taken, that can all be done skin to skin on the mother.
Wow, that's amazing because I didn't know that also as well.